This is my Preparator series for NEET PG. Concise, exam oriented notes for first revision. Let's start. Today we are revising Rosacea, which is integrated in dermatology with an exam oriented approach. The first concept we have in rosacea is etiology. In etiology of rosacea, we have four triggers. They are sunlight, spicy food, alcohol, and stress. One microorganism is also implicated in the etiology of rosacea, which is the Demodex mite. The next concept we have in rosacea is the location. It has a very typical location, which is the centrofacial area with perioral and periocular sparring in face, as shown in this image. The next concept is the morphological types. We have four morphological types in rosacea. The first one is the erythematotelangiectatic type, where there is a reddish background on which small blood vessels are dilated. The next type is the papulopustular type, which is a combination of papules and pustules. The next type is the phymatous type, which involves the nose, hence it is otherwise known as potato nose. The last type is the ocular type, which involves the borders of the eyes. The next concept we have is the treatment. In phymatous type, the treatment is based on the stage of disease. In early stages, we give isotretinoin, whereas in late stages, we give carbon dioxide laser. The other three types, namely the erythematotelangiectatic type, papulopustular type, and ocular type, have common modes of treatment. Two classes of drugs are used here. One is the alpha agonist, in which brimonidine is chosen. The other class is the antimicrobials. Antimicrobials are further classified as topical and systemic. In topical, we can choose metronidazole, whereas in systemic, we can choose doxycycline or ivermectin. The next concept is prevention of rosacea. We can prevent rosacea by applying sunscreen, by avoiding triggers, and also by avoiding application of topical steroids. The last concept in rosacea is differential diagnosis. The DD for rosacea is malar rash of systemic lupus erythematosus. Now let's look at the difference between rosacea and SLE. Rosacea does not accompany with systemic symptoms, whereas malar rash of SLE is almost always accompanied with systemic symptoms like arthralgia and fever. In rosacea, papules and pustules are present, whereas in SLE they are absent. That's it for this topic. See you in the next one.